Welcome back. Right now, officials are tracking a cluster of COVID-19 cases in Provincetown, Massachusetts, and have noted that people who have been fully vaccinated are among the cases found in the area. So it begs the question, what does the vaccine protect against? To talk about that, we bring in our 9Health expert, Dr. Payal Kohli. Good morning, Dr. Kohli.
Good morning, Natasha.
So we've talked about this before, but it seems like a good time for a reminder. But what do vaccines protect against? What are they designed to do?
So, I think of a vaccine kind of like a trainer for the Olympics. It really teaches your immune system how to be ready for the competition. So it doesn't necessarily give you the infection. It just shows you a piece of it, gets you ready for when you might be exposed to the infection.
Right. And so I want to talk about the difference in immunity, the immunity that you get from getting the vaccine versus the immunity you get if you were previously infected by COVID-19. Can you talk about that?
Yeah, this is a good point, because even those that are previously infected are recommended to get the vaccine, because we think the vaccine increases the reliability of the immunity. So almost everyone who gets the vaccine gets immunity, as opposed to natural infection where it's more variable. It increases the depth of immunity, so you're more likely to have more antibodies, and it increases the duration. Now keep in mind, the vaccine only teaches you to fight one part of the virus, which is the spike protein, whereas when you get the natural infection, you get antibodies to all different parts of the virus.
Still knowing the science, there are a significant amount of people who say that they don't want to get the vaccine. Being a doctor, having your practice here, what is the biggest fear from people when they say, I don't want to get a vaccine?
Every single day, I have at least 3 or 4 that don't want to get the vaccine. And the biggest fear is it was rushed and we don't know enough about it. And to them, I would say this is one of the interventions in medicine that we have studied on hundreds and millions of people, which we don't have the luxury to do for a lot of the other medications that we use. And we know with the history of vaccinology that if you're going to have any kind of adverse reactions, they happen within 3 to 4 months, not years later.
Not to mention doctors, nurses, health professionals have all gotten the vaccine. So they know the science behind it too.
That's exactly right. People are putting their money where their mouth is. They're getting the vaccine themselves, and they're getting their kids to get the vaccine. So if they were so worried about it, they wouldn't have.
Right. I want to talk about what's going on in Provincetown, Massachusetts, with the cluster of cases that are coming up, and a lot of that are breakthrough cases. So some people might say, okay, well, clearly the vaccine is not working if people are still getting infected with COVID. What do you say to that?
Well, I would say a couple of things. The first is nothing is 100%. We know that the vaccine was not 100% effective. It was 94% effective. So we expect some cases. The second is, as the infection in the community goes up, the number of breakthrough cases is likely to go up. But the third and most important, I think, is that even if people get these cases, they're not ending up in the hospital. They're mild illnesses, which is what we wanted to do with the vaccine. Natasha, I like to compare it to a seatbelt. So seatbelts work to reduce your risk of dying dramatically, but it doesn't guarantee that you can't have a fatal injury in a car accident.
That's a great analogy. And I also feel like although it's not 100%, the efficacy is still high.
It's extremely high, even against the Delta variant, which is a whole new version of the virus. So we're looking at 88% efficacy with 2 doses against the Delta variant. Now, it can go down as low as 63 in the real world, but that's still pretty good if it keeps you out of the hospital.
Okay. All right. Well, appreciate you coming on the show and talking about this. Nice to see you.
Nice to see you, too.